Hey guys, my name's Sam and welcome back to Prep Medic. In this week's video, we are talking about emergency care for somebody that's choking. Alright, so this video should be pretty short considering this is a pretty simple concept to grasp and it's pretty easy to portray through video. Now, I will say that watching a video on YouTube does not constitute real medical training. So this is a good refresher, this might be a good primer or intro, but I would highly suggest that you go get hands-on training as soon as possible from somebody that knows what they're doing. Whether that's an American Red Cross, AHA, or a friend that has some expertise, you need to get hands-on training in this to do this properly. So in this video, I'm going to discuss some of the indications that somebody is choking, how to recognize somebody that is choking, and then we're going to discuss treatment for adults and pediatric patients because they are managed slightly different. Guys, recognizing choking is not difficult. All you have to do is walk up to somebody and ask, "Are you choking?" And they're going to nod yes or no. Oftentimes, they'll display the universal sign of choking, which is holding their hands up to their neck like so, and these are all indications that you need to intervene. Now, I will say that if the patient is coughing or making noise, even if they're having trouble breathing, that is a partial airway obstruction, and we don't actually want to intervene at that point. If that's the case and it's just a partial obstruction, coach the patient, try to calm them down, and encourage them to continue coughing until they clear that obstruction. In the meantime, I would recommend you call 911 or emergency services in case that does become a complete airway obstruction and you are unable to clear it at that time. If somebody has the partial airway obstruction, you want to sit with them and monitor their condition. If they stop making noise or they're not responding appropriately, that's when you need to jump in and do something. So if somebody does have a full airway obstruction, we're going to perform the Heimlich maneuver on adults. That's really simple. All you have to do is get behind the patient, put one fist right above the belly button, put the other hand over that fist, and pull in and up in sharp motions. You're probably going to have to do this multiple times. And what this is accomplishing is it is increasing interthoracic pressure and hopefully will dispel the object that is obstructing their airway. Like I just said, oftentimes you'll have to do this multiple times, potentially 6 to 10 times before that will become dislodged. There is a chance it will be unsuccessful. So while you're doing this, try to direct somebody to call 911. If you see somebody choking in front of you, start the Heimlich maneuver before trying to call 911 if you're the only one in the area. If the choking victim becomes unresponsive while you're treating them, you're going to lay them down on the floor and initiate CPR, even if they do have a pulse at that point. That is because the chest compressions hopefully will dislodge that object and you'll be able to pull it out of their mouth. Every time you go to do your 2 rescue breaths after 30 compressions, you're going to open their airway and you're going to look into their airway and see if you can see what's obstructing it. If you can see it, you can reach in, grab it, being mindful of the teeth and making sure they're not going to bite down on your hand. If you cannot see it, never perform a blind finger sweep because that might push the obstruction farther down and make it worse or even harder to dislodge with CPR. For trained healthcare providers out there, this is when you'd initiate direct laryngoscopy and try to reach the obstruction with McGill forceps. Once again, you're not doing a blind stick with your McGill forceps. You're trying to see the obstruction and pull it away from the vocal cords. In some very extreme cases, a cricothyrotomy may be performed by a healthcare provider, but contrary to Hollywood films, this is not something a bystander should ever attempt to do. To quickly recap adult care for a choking victim, you're going to first identify that the patient is choking and confirm it is a full airway obstruction as they're not making any noise and they're not able to cough. Once you've confirmed that, you're going to make sure it's clear what you're going to do, come behind the patient and perform the Heimlich maneuver potentially 5 to 10 times until the airway obstruction is expelled from their mouth. If the patient goes unresponsive, you're going to lay them down on the floor and you're going to perform CPR at a 30-to-2 ratio. Every time you check and you do your rescue breaths, you're going to open the airway and you're going to see if the obstruction's there. If you see it, you're going to reach in, grab it. If you don't, continue CPR and every time check that airway. Never do a blind finger sweep. Children and babies are managed a little bit differently. And I'll have a demonstration over here, but I do apologize. The baby is going to be simulated by a towel because 1, I don't have a child of my own, and 2, I don't have the same training resources I used to. So that will be my simulation. Now, like I said, it's managed a little bit differently. If you notice a baby is choking, they're going to have the same signs as an adult. You're looking for no air movement, they aren't making any noise, and they are not coughing. Once again, if they're doing any of those things, we're going to monitor their condition, call 911, and make sure that it doesn't become a complete airway obstruction. If it becomes a complete airway obstruction, you won't hear any sounds, they won't be able to cough, and that's when you need to intervene. So for those babies, what you're going to start by doing is you're going to take the baby and you're going to hold it with the head down in your hand and face down to the floor, and you're going to deliver 5 back blows with your hand. You're then going to switch arms and you're going to rotate the baby over, face up, and you're going to give 3 chest compressions with 2 fingers, the same depth that you would in normal CPR. You're going to repeat these steps until the airway obstruction is clear, or if the baby loses a pulse, in which case you're going to initiate standard CPR for a child, which is 30 to 2 compressions for 30 compressions, 2 breaths if you're on your own, or it's 15 to 2 if you have a second rescuer with you. Once again, it's very important to get 911 activated really quickly. However, don't delay care for the patient to call 911 because chances are this intervention will be successful for you. I want to discuss just one mimic of choking that we see pretty often in the emergency field, and that is an esophageal obstruction. So a quick anatomy refresher for you guys. Your trachea lays right in front of your esophagus, and your trachea is the tube that delivers air from your mouth to your lungs. Your esophagus is a much less rigid tube right behind that delivers the food from your mouth to your stomach. Sometimes, especially in elderly populations, they'll have what's called an esophageal stricture, which is a closure of the esophagus leading into the stomach, and food will get lodged there. This will make them feel like they're choking, they'll feel like they have something caught in their throat, but they'll still be able to breathe. And that's one of the big reasons why we're looking to see if they're able to move air or not. In these situations, they'll try to drink some water and they'll probably vomit the water right back up. This is still something you want to call 911 for, because if that does become dislodged and comes back up, it could become an airway obstruction. However, there's nothing you can do for this patient, and just monitor them and make sure it doesn't become an airway obstruction. Call 911 and get them help right away. Before we end, I just need to reiterate to you guys that this is not a certification course. I'm not certifying you to do anything. I'm not authorizing you to do anything. This is some knowledge for you. Maybe it's a refresher or a primer, but make sure you're getting hands-on training. I would highly recommend American Heart Association courses. Any BLS course, so that's their basic life support course, which is what took the place of CPR, will go through Heimlich maneuvers and treating choking patients. So I would highly recommend you get one of those classes and get it soon, because this is a very life-saving skill that's important for everybody to know, in my opinion. If you have any questions about this video, please leave them in the comments down below. Like always, I enjoy hearing what you guys have to say, and I will see you next week.